every other Friday, and then every Friday during the season, we were telling you about Rothman, right,
Yeah.
BG?
Yeah.
And
Saved my life.
The great doctors doing God's work, the doctors at Rothman Orthopaedics. And Rachel Shakked joins us. Dr. Rachel, hi, Doc. How are you?
Hi.
What's up, Doc?
Nice to meet you guys.
What a pleasure, Doc. Doc, meet Meg.
Hey, Doc.
All right?
How are you?
All
Hi.
right,
Nice to meet you.
So Meg is in charge. She's the CEO of the the host city CEO, executive CEO, bringing the World Cup to Philadelphia. And I know how much you love sports, and the mecca of sports is going to be here. And Meg is running this thing to bring it to Philadelphia, be the center of the stage.
Awesome. It's an honor to meet you.
Great to meet you, Doctor. And we appreciate all the good work you're doing on our athletes, even on the field.
So, Doc, we're going to talk Achilles tendons today because of Jason Tatum. Now, I'll tell you that Rothman saved my. Well, I have a cadaver Achilles in my left foot. I thought I was going to have it in my right foot. And I'm like, oh my God, it's going to go. And I go see the great doctors, Dr. Pedowitz, and all you people over there who I love. And he's like, listen, I think we can fix this without surgery. And they put these patches, what are the patches for your heart?
Nitroglycerin patches.
Yeah,
yep.
he had me put them on my Achilles to stimulate the blood flow. And my God, it worked. No pain.
Yeah, I know.
It's amazing. You guys are brilliant.
I know. Whoever figured that one out was very smart. An off-label use of that medication that's normally cardiac.
It's incredible. So tell us, we know you're not the physician for Jason Tatum, but we talk about injuries on this segment. And tell us about the torn Achilles, because it's the most painful. I thought I got shot by a gun in the back of my leg.
Yep. That's what people say. Almost everyone who walks in who has an Achilles rupture has a story like that. They think that someone hit them in the back of the leg with a bat or someone kicked them. It's the same story every time. It's the Achilles, actually, it's the biggest tendon in the body, but has a weak spot because the blood supply to the central part of it is not very good. And so the Achilles is undergoing incredible forces, especially in basketball players, football players, soccer players. And so with certain types of specific forces, it can cause it to rupture. And that's because it is like a weak spot. And,
mine ruptured and curled up into my calf. So it was a complete tear. What do you now? What's the protocol? Because I did mine a while ago and it's changed a bit. So what's the procedure now?
Yeah, so there's still a number of really good options, but we've definitely made changes over the past maybe 10, 20 years, moving towards smaller incisions, moving towards enhancing the repair, using anchors sometimes or special sutures. Some docs are using biologic augmentation that can help with the healing process. And in addition to the surgery itself, the rehab has come a long way too. It used to be that we would put patients in a cast after surgery.
Oh my God, Rachel.
For a long time.
Doc, listen, the worst thing in the world. So I'm in a cast, my foot pointing down. All right.
Yep.
So doctor's like, all right, cast comes off I had, do you want to talk about shrinkage? My calf, I lost all the muscle, my calf muscle, right? Atrophied.
Yeah. In like 2 weeks, right?
Yes. And then
so fast.
Then he starts to push on the Achilles to stretch it out.
Oh, man.
On my back, on my foot.
Like?
Oh, my God. It was worse than the rupture. I was like, the pain was ridiculous. It was unreal.
Yeah. Treating Achilles is difficult because you really need the tendon to heal before you start strengthening the calf muscle again. So all that time that you're letting the tendon heal, you're like losing muscle. So that's why the recovery takes so long and why the return to sport has been such a, like months, 8 months, 9 months. In some cases we've gotten it a little bit shorter, but it's almost like on the level of an ACL rupture where the reconstruction needs to heal before you can start building the quad again.
Are you is it a predestined injury? Like, is there a weakness in it? And if so, like, is the other one at risk?
Yeah, it's a great question. I mean, most people who rupture their Achilles have no warning. It seems like it happens out of the blue. There are things that can increase your risk of the Achilles rupturing, like certain steroids. There are certain antibiotics that are risky. Some people have tendonitis, probably like what you have on the other side. And if there's bad tendonitis, sometimes that can lead to a rupture. But many of these professional athletes and college athletes who sustain this injury have no warning whatsoever. And there's nothing we really know of that can prevent it. And once you rupture one side, especially if you're on the younger side in like your 20s or early 30s, you are at higher risk for rupturing the other side. The risk is still low, but it's there, and it is slightly elevated, unfortunately.
Is there ways to, like, especially for like weekend warriors, like, because that's what we do here, to ways to help prevent any sort of Achilles injuries, like, obviously stretching and stuff like that, but ice, I don't know. What's the best way to prevent it?
Yeah, I mean, stretching makes a lot of sense, because if you have too much tension, if your tendon is too tight, you can imagine that it would probably be higher risk for rupturing. Other than that, there's nothing that's been proven. They've looked into like types of sneakers, maybe more flexible sneakers has a lower chance of leading to rupture, but it's not really proven. So as of now, we know that if you're starting to have some symptoms in your tendon, then I would pull back. But to prevent that rupture that's out of the blue, unfortunately, there's nothing that we know of besides stretching that seems to help.
Dr. Rachel, you are terrific. All right. You're terrific. You got to be a part of our World Cup coverage, okay?
I love it.
You in?
I'm there.
I love it. That's great. Doc, thank you so much for your time. Continue doing God's work, really. You guys at Rothman Orthopaedics do so much good works. So thank you for keeping us in motion.
You're welcome, and thank you for having me.